Top 5 Most Useless Health Screenings. Don't waste your money. Many clinics, in order to earn more money and attract more clients, start pushing various useless services that, in reality, provide no benefit to individuals. Moreover, they are so popular and equally useless. Patients end up spending their last pennies to undergo them, but they don't reflect the true state of affairs inside the body. The most frightening aspect is that they lead you to waste precious time. You undergo a procedure that doesn't depict the real picture, treating a mythical illness. Meanwhile, your actual chronic condition goes untreated. So, in this video, I'll talk about the most popular and useless procedures that should have been forgotten long ago. Watch this video until the end, and I'll tell you about the most useless procedure that everyone knows about, but it's so useless that it can be dangerous in some situations. How useless are these procedures? They might not cause significant harm to your body, but incorrect treatment resulting from improper screenings can lead to kidney, liver, and cardiovascular pathologies. Definitely. Very often. But I had an interesting patient once. She was diagnosed with vegetative vascular dystonia based on screenings. She underwent MRI of the brain, ultrasound of the neck vessels. And she was given such a diagnosis. Firstly, such a diagnosis doesn't exist. It hasn't been used in any medical practice for a long time. This diagnosis, and secondly, behind this pseudonym hid iron deficiency anemia. The girl indeed suffered from low iron levels. She went to doctors, neurologists. They prescribed various medications, which, by the way, haven't been thoroughly studied for their reliability and can also lead to various internal organ damage if used frequently. But the worst thing is that the girl suffered for 3 years from a completely different diagnosis when she was diagnosed, in general, incorrectly, and treatment was prescribed. So, the top 5 most useless screenings. And the first screening is MRI of the entire body. It's very important to understand that when you undergo any screening, there should be a proper indication for it. For example, if we're talking about an MRI, it excellently shows soft organs, but it's very poor at showing organs with cavities. For example, there's a person getting an MRI of the lungs. I don't know any specialist who could correctly interpret these results. Meanwhile, MRI shows spinal diseases, hernias, protrusions quite well. It shows the brain quite well. But there should be clear indications for this. That is, each organ has its own examination. If you spend 5 hours in an MRI machine to undergo a complete examination, you'll just heat up like in a microwave and won't get reliable information. But you'll spend a huge amount of money. And secondly, the pain in the lower back can be caused not only by spinal pathology but also by kidney pathology, for example, urolithiasis. Another useless screening is the magnesium test. Magnesium is indeed a crucial micronutrient responsible for our metabolism exchange, brain functions, and psyche. However, getting a blood test for magnesium is pointless because only 1% of it is present in the blood, with the majority found in tissues. Consequently, a blood test for magnesium is not informative. Moreover, an elevated level of magnesium in the blood may be a result of other conditions, such as hypothyroidism, which can lead to incorrect treatment. The third useless screening is the cortisol test, the stress hormone. Although cortisol is indeed significant for assessing the body's condition, its level fluctuates throughout the day due to various factors such as sleep, food, stress, etc. Therefore, a single cortisol test does not provide information about the actual stress level in the body and is not indicative. The fourth useless screening is the stool test for dysbiosis. This test only shows a fraction of the microorganisms inhabiting the intestines out of hundreds of thousands of different species. Therefore, the results of this test may be uninformative and not reflect the actual state of the gut microbiome. And finally, the fifth useless screening is the urine analysis for stone composition. This analysis can only provide a general idea of the composition of stones forming in the kidneys or bladder but does not provide precise information about their origin and causes of formation. In conclusion, these screenings can not only be useless but also harmful to your health as they can lead to incorrect treatment or diagnosis. Therefore, it is always advisable to consult qualified specialists and follow their recommendations rather than blindly trusting advertisements and popular but useless screenings. After consulting with a doctor and developing an individual health maintenance plan, it's important to follow the specialist's recommendations, regularly undergo scheduled screenings and tests, and carefully monitor changes in your health status. If you have any doubts or questions regarding the prescribed procedures or recommendations, don't hesitate to discuss them with your doctor. The more informed you are about your health and bodily processes, the more effectively you can manage your health and prevent the development of potential problems. Ultimately, health is your most valuable resource, so it's worth devoting enough attention and care to it. Use common sense, seek help when needed, and remember that self-care is an investment in long-term well-being and quality of life. Even if treatment was prescribed, for example, probiotics based on an analysis, it is entirely incorrect. Because the cause of your diarrhea, bloating may be both pathological growth of microflora and diseases of the intestines, pancreas, liver, and gallbladder. Also, stool tests for dysbiosis are often prescribed after taking antibiotics. Or, for example, you took antibiotics, but the course was short, for example, up to 5 days, and your microflora restores itself wonderfully, and you naturally don't need to take a dysbiosis test. Many doctors are guided by various guidelines, global practices, and clinical recommendations. However, sometimes a doctor may prescribe procedures under the influence of informational noise, pharmaceutical representatives, or simply due to a lack of information or time. Doctors may simply not know what they are prescribing and for what purpose. For example, testing for antibodies to Helicobacter pylori is often prescribed to detect this bacterium. However, this test only shows traces of the bacterium, and even if it's long gone, antibodies can still be positive. This can lead to the prescription of antibiotics, which can harm health because the cause may be completely different. There are 2 types of tests to detect Helicobacter pylori, the urease breath test and gastroscopy with biopsy. Each of us has probably encountered useless screenings that could even lead to disastrous consequences. Such extensive experience confirms how important it is to carefully consider medical prescriptions and not burden the body with unnecessary procedures. Often, informational noise and the pressure of various interests can confuse both doctors and patients. Instead of blindly following all recommendations, it is important to ask questions, understand the essence of procedures and treatments. This will help avoid unnecessary risks and unpleasant consequences. We all encounter situations where unnecessary screenings or treatments are prescribed. It is important to remember that taking care of your health is not only about following doctors' instructions but also actively participating in the decision-making process about your health.